The people that you see here are family, they're friends, and trust us to all of their healthcare needs.
We've made a promise to them. It's a promise of fully integrated care and, above all, a commitment to exceeding expectations.
We set off a few years ago to be recognized as one of the best community hospitals in America. And it gave us such a grand vision that enabled us to do some big things in search of that goal.
In order for us to be successful, we need to let that value extend and grow our business across all service lines, but most importantly, going into markets that traditionally have not used Lowell General Hospital or Circle Health.
We knew in order to bring the Saints campus live and continue to deliver on our growth strategy, we could only do that under an ITWorks model.
And by having Cerner as a strategic partner, we were able to very quickly integrate two campuses together. It was 11 months, which was magic.
We have continued on that growth trajectory ever since, bringing live 3 urgent cares and multiple other off-site properties.
2 years ago, we formed in conjunction with Tufts Medical Center, WellForce. And WellForce is really a new integrated health delivery system that enables us to bring more care to the community.
Tufts really functions for us as a distributed academic medical center so that we are able to retain patients and families in the community.
We're able to keep care local, provide high quality, low cost is how we define value.
In 2015 into 16, we have our third founding member with Hallmark Health joining WellForce.
5 years ago, we were about a $250 million organization, one facility. Now, as of January of this year, at the WellForce level, we're $1.8 billion. So pretty phenomenal growth.
Having an open and accessible architecture helping us to be able to move information elegantly across the system is one of our levers of success.
In our primary and our secondary service area, there's about 600 physicians that provide services. And when you look at that, there's a huge diversity in the electronic medical records.
What we've been able to do is to take the various systems in the area, the various medical records, which many physicians are still struggling with, and figure out a way to really make them come together here at Circle Health.
Now we actually have an integrated bidirectional interface for almost all of the providers in the Merrimack Valley. So it allows the physician from within their EMR to go out and select the information that's relevant for them and their care and pull back only what's relevant.
So recently I operated on a patient who has some cardiac issues, and we were able to immediately look at all of her old EKGs, look at her prior cardiology notes, and tailor her treatment based on that previous information. This is something that would have been essentially impossible with paper records.
One of our biggest areas that we want to make sure that we do an exceptional job in is in safety for our patients in medication administration.
For the nursing staff, especially in the ICU setting, they're giving meds constantly. Having it right here at the bedside, the nurses can bring the meds into the room, they can scan their patients, they can scan their meds. It acts as another check right before med administration.
We have over 95% of our patients' medications are scanned on a regular basis. We also have worked together on things like catheter-associated urinary tract infections and helping to build our best practice into the electronic record.
So when you integrate the clinical side and the financial side of the health system, you actually do streamline a lot of the workflow for not only the end users but also for the patients.
Now it's all one consolidated system, one integrated system where all the information flows from one end to the other.
We've actually seen about a 4% increase in our gross charges just based on the fact that we implemented an integrated system.
Our Cerner partners truly understand the needs of the organization, they get our strategic plan, and they're coming forward constantly to us with ideas and suggestions.
We're bringing the best of everything Cerner has, the latest and greatest code, the best and the brightest of their people, and integrating it fully into Circle Health.
And having an information technology partner that's now helping us to be strategically successful is a game changer for Circle Health.
It takes that whole team beyond the walls of this organization to ensure that we're continually on the forefront of providing great care to our patients.
Investment in IT is going to be very valuable and very important as we go forward, not only for the hospital, but most importantly for the patients.